Shall now go on to our next speaker, Dr. Sumeet Lahane. Paucity of time, I'm not properly utilizing the information which my expert panel could give. But then let's see as it goes on. Dr. Sumeet is Assistant Professor of Grand Medical College and Sir JJ Group of Hospitals, Mumbai, and he is going to be telling us about optimizing practice patterns in a government setup. And there's going to be an avalanche of questions coming your way, Dr. Titya. So,
good evening, everyone. Good evening, Chitra ma'am and Anaga ma'am. Thank you, ARC LDP, for considering me for this talk. So I'll be talking on optimizing practice pattern and government setup. The problems are more or less same, and I will be on the same line. And in the interest of time, I will try to finish it as fast as possible. So there is no financial interest. Look at this picture. If you want to get admitted yourself or your relative, will you prefer this, or you want to go and admit in this hospital? Of course, it goes that I would go here. And for a common sense reasons, the first was a government hospital and second was private. Now, why is though, and why the government hospitals are not progressing as they can in comparison to the private? So obstacles are the mentality and attitude of the paramedical staff and colleagues. The duty given to them 9 to 5 is many times converted into 10 to 3 by their own seniors and themselves, and they don't want to work to the full time they have been allotted to. Infrastructure and tedious purchase procedure does not allow government hospital to have a good technological support that they should have. Multitasking by clinician, a clinician who wants to work has been given so much work that they cannot work efficiently. I'll come to that later. And of course, then it becomes a equation of less time with the more patients. So now there is question, so there has to be a solution. So how do we plan a solution in such cases to overcome this problems? So mentality and attitude of paramedical staff. You will always see that this kind of people working with you, let it be any setup you are in. So the mantra we follow is be the change you wish to see in the world. Like when I recently joined as a lecturer, I was in the peripheral center, and I used to go to my OPD at 7 o'clock, and the OPD attendee there used to open the OPD at 9 o'clock. After 3-4 days, he realized that I'm coming before him, and he came to me, old gentleman, and said that you should come late because patients are used to coming late. I said, I am used to coming early, and that is my habit. I will not change. You can open the OPD whenever you want. I will be here at 7 o'clock. After 2 days, he started coming early before me, started cleaning the OPD, and I could start my work early as possible and do the more work efficiently in the given time. So unless I dedicate my time, they will not dedicate their time at all. Empathy is very important because for them, the people working with you, for them to be your team, you are their family doctor. Let it be their relatives knee pain or there is ankle sprain, they are going to come to you to ask for a solution. And you putting your word to your colleagues of the different subspecialty that please take care of so and so patient, I think goes a long way, and then you develop a different kind of relationship. Now you will say we cannot do everything for all the colleagues that we are working with, let it be 50 or 60. You don't have to do all that. The inspiration that you provide is basically contagious. Out of 50 staff, you just have to inspire 2 or 3, and with them, they will do the rest of the work of inspiring all the population or all the people working with you. Now, infrastructure is a tedious process. Why? Because if I want to buy an equipment, I have a waiting period of 2 to 3 years because the government system takes that much of time to buy an equipment. Then what to do? Very simple. There is something called as CSR. Every huge company want to give a part of their benefit for some charitable process, and we have our own social work department who is on always watch of such companies, and their 2% makes a huge profit for us and basically for our hospital to get the infrastructure. Then you can always have a partnership in which way, because any company coming with the new technology has basically want to validate their research, and what we have is a high volume of the patients. So this kind of a contract between a technology providing companies and you as a government setup helps you to get the technology and them for a research. With this, you can of course increase your infrastructure in an optimal way. Now, what is multitasking by clinician? Now, in a government hospital, a clinician is not only a doctor looking after the patients. He is on multiple boards of inquiry committees. He has to do a lot of clerical work, answer to multiple RTIs which are not related to him or his department, and that takes a lot of time. And then it becomes very difficult for him to work efficiently, which leads to the equation of less time, more patients. How do you do it? How do you come over this? You train the available staff. We do have an optometry school. There are optometry students, senior optometrists. Is the manpower what you have, and if you train them well, they basically do all your primary workup, almost all the patients. Now we do have a counselor in the corporate hospitals who counsels the patient about everything. But if you have a postgraduate and the fellows trained well, they can be better counselor than anyone else. Suppose you are caught up in certain meeting, or you have been given some administrative work and you're not able to help in your OPDs or OTs, then basically the triage of time you need to do. And basically, if you have a trained people with you, they can take care of your follow-ups, and you just have to go and see certain new patients, which basically help you to work more efficiently and still go on the process. You of course set up the fixed protocol, that you train them well, that they should know that how the each case, especially emergencies, should be managed. So even without you being there, your hands are still working in the hospital. Now, what are the advantages? After talking about so many obstacles, are there any advantages of working in government hospital? Of course, they are, and they are multiple. Suppose I'm sitting in a private practice and I want to send a corneal scraping, or for that sake, I want to do a certain checkup which is difficult to find out around. Then that is not a scenario here in the medical college or government hospital. I want to give an example that 2.5 years back, we wanted to start our own autologous serum and PRP eye drop. And then we realized that we are short of certain things like reagents and the centrifuge. And I just have to call the biochemistry department, and whole of the department much more happy to come and help us to make this eye drops. And they were very keen to be a part of this clinical picture than to just sit in the labs. Similar thing with the pathology, and the similar thing with the other departments. So basically, interdepartment correlation, let it be microbiology, pathology, is very good in a government hospitals. Now, second thing is that you need to have a constant will to reach more people, because everyone can't come to you, and the way to reach them is camps. Like you see, as a person working in the medical colleges, we are well connected to all the districts in the state, and we know where there is a doctor patient disparity, and where there is a high volume of the patients still not treated. So we can of course do a surgical camp, and we can, as a government authority, it becomes easier for us to get other permissions and approach NGOs to help us to do surgical camps. Now that's how we begin our journey in 1995, and our OPD and OT increased almost 10 to 20 times with the outreach surgical camps. Now, this you need to reach more number of the patients, because as a government institute, you are not very active on the Google, you are not very active on the other channels, but these patients basically are advertising agencies for you. So more the patients you reach, they are the word of mouth for you, and they publicize your work, and basically you get more patients. Now, when you are getting more patients, you need to develop your hospital and upgrade it too. Now, as a simple thing, you do get as a bonded, or you get new candidates to work in your hospital as a junior consultant. But as a patient, you always want to have a senior surgeon's opinion. And as a fellow, when you are joining, though you have done a trained fellowship, you learn still lot of things post your fellowship when you are in actual practice. So, in every district, we do have surgeons who are of ample experience practicing their specialty since years, and your hospital board is authorized to take them on an honorary basis, so that they can come for a particular time to your hospital, and then they can basically discuss and treat the complex cases. And you, as a junior consultant, and your colleagues can get trained with them. So basically, you can develop a subspecialty with the good combination of junior and senior being there. And of course, you can flourish a subspecialty practice even in a government hospital by having more people of the same specialty. Research work, because we do have EMR, and there is large retrospective data, prospective data can be available, and that can be used for publications and the research. You need to train your PGs and fellows because you don't have to write every paper on your own. If one of them or two of them gets trained, whatever work you are doing is basically efficiently managed by them, and you can have lot of publications from your institute by training your fellows and PGs. So a simple thing here is when you build a good team, basically you have a multiple hands and you can still do what you need to do, and the other work gets done by delegating the work to the proper people. So the steps for optimization are: inspire your colleagues and the paramedical staff, public-private partnership to raise the infrastructure, delegate the work and train your team, reach out a larger population, and develop subspecialty in your department. So there is always an opportunity when there is an obstacle. You can cross the mountain with the mindset of the positive attitude, and you can't just give up that just because you are in this practice and you've been given other work, you cannot raise the standard of care in your hospital. Of course you can. Making a team is utmost important because you yourself cannot do everything unless you have a good team, and once you're together, you know, you can walk a long way. And that's why it is very important to develop a team and infect the people with the inspiration. Thank you again for all of your patient listening.
That was a wonderful talk, and you really actually made us realize that growth is possible in any segment of practice. It's how you rise to the challenge and how you take it forward. But at any point of time, I know you're doing really well, but at any point of time, what would you tell youngster here in this crowd that would it become restrictive if you are in a government practice, or should it be used as a stepping stone to move into private practice, or do you get very professional about running it as a very ideal government practice?
Ma'am, basically, I would take it as one of the stepping stones because, as I said, once you are done with your subspecialty practice, you are not seen everything and you learn a lot post your training. So, being in a government institute or the larger institute is one of the thing which you exposes you to the more patients and, of course, to the administrative duties, which becomes difficult to when you start your own clinic. And there are, as we heard from our own colleagues, that there are a lot of hurdles that you need to come over. So being in a government setup, you can have your own contacts and you know how to exactly develop a practice later. Now, then that is completely an individual decision that you need to continue the practice you are in. If that gives you the satisfaction, then you can continue in the same. And if you want to develop your own private practice, that door is always open for you if you are willing for that. I think TTL sir would be
yes, TTL. Yes, Dr. TTL, I actually wanted to ask you, why is it that, of course, yours is an epics setup and you get funds coming in? What is the reason why the government hospitals in our country are not able to evolve? Is it the shortage of funds? Is it that the wrong personnel are heading each of these institutes? Or is it that there's so much of corruption which is rife, which is the only main reason why these hospitals are not evolving? Dr. Titian?
You put a very difficult question which can be answered in such a platform. As far as things which are, people point out the government sector is not coming up to the expectation of the country. And I'll not talk about the other part in terms of character of people in this country. It is same everywhere, not in the government sector, it's in the corporate sector, private sector, everywhere. The character of Indians are similar. So we should not blame an individual in this regard. As far as the funding is concerned, I think if you look into the amount of money in the health sector, compare the developing worlds, developed countries, and the poor countries, a huge difference. And the amount of money they get through their health sector in this country in last few years, I think this particular since this 5-year budget has improved a bit. That's why it improved the infrastructure in various parts. If you look into a government sector, I think we can divide into 2 or 3 parts. One is a teaching institution, which are medical colleges or institutions where they have a multiple responsibility, which Sumeet had nicely pointed out. Second category of hospitals are district level hospitals, which are classically cannot be termed as a teaching institution. They are basically servicing part of our country, which connects to our various sub-centers and primary centers. Definitely, there's a lack of infrastructure in these areas because these concepts have been developed a long time back, 70s and 80s, and government has not done to improvise these areas. There has definitely been a point discussion happening nowadays to improve these district hospitals to make it them look like a medical college in future of all the district hospitals of this country, which might improve things a little bit. But as far as government institutions are concerned, where teaching is happening, like medical colleges, which are around 174 medical colleges, apart from the other institutions, their prime responsibility, apart from the patient care, second is giving a good teaching to the people who are coming through various academic exams. So these institutions are getting the best students possible, and they have to come out with the flying colors to serve the country. So which is also has gone down in last few decades in terms of teaching quality wise also. But that is our resource. So I think apart from looking into the barriers, basically it is a red tapeism which is happening in the government institutions. Sometimes you may have funds, but to use that funds to a proper areas gets very difficult because you may have to opt for the lowest quotation for purchasing any equipment and instrument, and that might not give you a best possible things to be established in that area to build up the institution. And which Sumeet talked about, the work culture in an institution or a medical colleges or a hospitals is totally different than a private area because there's not much incentive for these people for working in that particular time or a particular area of work. In these cases, they are just bound for their pay, which automatically increases as they get into after a few years in terms of seniority wise. Incentive wise, work cannot be done in a government place. For that, you require some other modes. There will be a few individuals who can motivate these people to work in this area to improve. The motivational thing also is a difficult part in the government places. I understand most of the government places may not improve the way we want as in the private sector. So that's a difficult area. Unless we have a freedom of autonomy of medical colleges, medical institutions, from the other administrative point of view, things will be very difficult in this. Autonomy has to be given to the medical colleges. It may be a principal, it may be a medical superintendent, it may be director, to really go into the best possible purchase for equipments, best possible establishment to happen. And that will definitely change the future of our younger generations. As far as few institutions are concerned, they are doing good job. We have a good institution also. We are producing a large number of undergraduate people. I think as I talked about initially, the health sector providers, 80% are private areas and only 20% government sector. As far as education is concerned, 80% education done by government sector and only 20% by private sector. If today private sector also takes up the teaching, or especially super specialization teaching, then that will also have better people coming out in a market, in a to build a practice. So that will be an actual balance. So private sector, corporate sector has to take a burden of teaching and the fellowship programs so that we have a better category of people coming. Because today, if we have thousands of people take undergraduation courses, complete them, then post-graduation becomes very difficult. The space becomes less. After that, super specialization becomes a little more harder because you have lesser space in the government sector. So I can say here, we need to divide the both areas, patient care and teaching of our young generation, equally from both sides.
Thank you. Thank you. That was a very profound words which I heard from you. And I'm sure in your tenure, All India Institute is going to see something very definitive and good. All the best.